Hello, my name is Sarah, and you're watching part 2 of a 5-part video series regarding male infertility. Earlier, part 1 was regarding the basics of male infertility. Today, I'm going to talk with you about the causes, treatment options, and also alternative options regarding male infertility. First and foremost, you need to realize that you need to just sit down and speak with your doctor, have an honest conversation, and also please note that these are great options, but it's not a one-size-fits-all. What works for you may not work for someone else. And even if you cannot consider surgery or adjusting medications such as anti-seizure medication or anabolic steroids, there are options such as in vitro fertilization, adoption, or going to a sperm bank. So many of the causes of male infertility can range anywhere from medication to genetic problems. One of the main causes of male infertility, leading at 38% of male infertility, is abnormally large veins that bulge in the way of the testes, which blocks the sperm traveling. That can be addressed through surgery. There are also cases with hormonal imbalances, such as too low testosterone, which you can ingest more testosterone, via prescription. Please remember, though, at the end of the day, you need to sit down and discuss it with your doctor openly, and also look into insurance plans and options. Many of these may not be covered by your insurance. Thank you for your time and for your attention. Our following video will be on embarrassment, and that will be video 3 of our 5-part series. Thank you again.
So it's important to understand how I approach health in general. Usually just simple avoidance. Prior to meeting my wife and getting married, my doctor visits between then and when I was in high school and living with my parents were exactly 0. So pretty much anything involving me in health is usually avoidance. Not necessarily the greatest tactic, but I just find it very difficult to think about it. Thinking about some movie coming out, some book I really like, homework I have to do, my job, anything but how I'm feeling or should I go to a doctor? It just doesn't usually even come up with me. So when this whole thing about going to the doctor's appointments with Emily and having myself checked out, it just didn't even occur to me. Now, everything that Emily went through leading up to discovering about my infertility would have had to happen regardless. That being said, it would have probably saved us a good deal of time and energy had we taken the time to check myself out. It came as somewhat of a surprise. It came a couple years into the process of us trying to have a child. So I guess it was definitely an important lesson learned about needing to take care of myself. Unfortunately, I still have those habits. They're very well ingrained with me. It helps to have a wife, but at the same time, I do know that I need to recognize that I'm a human being, I'm going to get sick, I'm going to have problems, and I need to start having doctor's visits and checkups and all of that. So, understanding how I approach health and recognizing that sex and health are not separate. They're interlinked. And so checking out my sperm count, or not too far in the future, checking my prostate, all of these things are going to be very important. So that's definitely been part of the process of trying to be a parent, is discovering the need to take care of yourself.